Imagine, for a moment, that a fire breaks out in your home. And in this reality, 911 doesn't exist. You might call the fire department directly, but they're not equipped to come to your location and only put out fires at the fire station. And the only people that will come to you in the community are the police, who, though well-intentioned, are meant to provide a very different type of public service. This lack of a fire-specific response seems ridiculous, right? Of course we should have targeted services to respond to life-threatening emergencies, whether that's fire, law enforcement, or physical health. However, in many communities across America, life-threatening mental health and substance use crises are treated as an afterthought, receiving a response that's not specific to their unique needs. A 911 call dispatches the police, who most often bring the patient to a medical emergency room or jail, or allow them to remain in the community but without assessment, treatment, or support. We have a patchwork system, made up of elements designed for other purposes, that doesn't have the capacity to treat the most vulnerable in our communities, even though an estimated 20 to 25,000 individuals in crisis go to emergency departments every day in the US. So how can we improve? The only solution to delivering crisis care worthy of our communities is to build a structure specifically for mental health, substance use, and suicidal crisis that is on par with other emergency systems, like we do for medical, fire, and law enforcement. By integrating 3 core elements, we can replace the patchwork fabric of our crisis care and develop a true safety net that can serve everyone, everywhere, every time. And in the process, we can reallocate wasted financial resources to places where they can have a deep community impact. It starts with regional or statewide crisis call hubs, call, text, and chat lines staffed by trained professionals who answer the call every time and direct people to the level of care they need. The onset of 988 is a great start. However, it will need to be supported by technology that empowers 988 to become an air traffic control for mental health and substance use crisis, enabling real-time coordination across the care spectrum. But a comprehensive crisis network cannot be built with only crisis call hubs. Additional services are necessary to ensure that a unified system of care is available when and how people need it. Services like mobile crisis outreach teams, 24/7 non-law enforcement mobile teams that go out in the community and deliver care to people wherever they are. This lessens the burden on law enforcement during situations where they're not needed and eliminates the anxiety people feel when a uniformed officer knocks on their door. And facility-based crisis receiving and short-term stabilization, facilities that say yes to every person that walks through the door, regardless of their level of need, allowing them to bypass the medical emergency departments. This not only provides specialized care to these individuals with less waiting, it also enables medical emergency departments to focus on the patients they're trained to serve, while drastically reducing wall time for police when transportation by police is warranted. With these core elements in place, mental and substance use healthcare can move out of the shadows and into the mainstream. Together, we can build an unbroken system of care that connects patients from the point of crisis to the level of care that's right for them. To learn more, visit crisisnow.com.
Hi, my name is Jeanne Carlisle with MHAM, Mental Health Awareness in Michiana, and I'm the Pro Bono Counseling Project Coordinator. The goal of the Pro Bono Counseling Project Coordinator is to improve the access to mental health care for those who would otherwise not have access due to being uninsured, underinsured, or unable to afford the cost of treatment. The Pro Bono Counseling Project offers short-term brief counseling up to 12 sessions, and it's counseling with a licensed mental health professional. And again, all sessions are free for our clients, and our licensed mental health professionals are volunteering their time to the project. Types of issues that are addressed through the Pro Bono Counseling Project can be really solved in those short-term brief counseling 12 sessions are relationship problems, life stressors, transitions, grief, loss, and mid to mild anxiety and depression. Who is eligible for our services? Individuals who are 18 years of age or older, couples and families who are residing in the Michiana area, which means St. Joseph County, Elkhart County, and Marshall County. If you're looking for more information, feel free to reach out to me, Jeanne Carlisle, Pro Bono Counseling Project Coordinator, or visit our website, mhamichiana.org, or feel free to send us an email, mha.michiana@gmail.com. Thanks.
Hi, my name is Kelly Lichty from Oaklawn Psychiatric. I'm excited to share with you today about our transformation to open access. Open access is our new low barrier clinic style model to engage in outpatient services at Oaklawn. On each of our 3 campuses, we have blocks of time scheduled daily where individuals from the community seeking outpatient treatment services can walk in to start the process. When they arrive, they'll meet with one of our access specialists who will complete initial paperwork and open a chart for them. They will then meet with a therapist who will complete a mental health and substance use assessment and talk with them about recommendations for ongoing treatment and care. To learn more and find out about the specific times on our campuses, please visit our website at www.oaklawn.org. Thank you. Lichty from Oaklawn Psychiatric. I'm excited to share with you today about our work on creating a continuum to treat crises in our community at Oaklawn. A crisis continuum involves someone to call, someone to go, and a safe place to go. The safe place to go is what we are working on creating with a crisis stabilization center. We are partnering with the community, including Beacon Medical Center, to create a center where individuals experiencing a mental health or substance use crisis that does not require immediate medical attention can walk in. At this center, we'll provide screenings to assess risk level, an initial visit with a psychiatric nurse and social worker who will work to stabilize and link to ongoing treatment. This center will be available for those 18 and older. Please visit our website and stay tuned for continued updates, including when this center will be open to the community. Thank you.
Hello, and welcome to the LGBTQ Center. We're located here in South Bend, Indiana, but we serve the greater Michiana area as well. One of the questions that's asked of us for this video is what kind of projects or programs do we offer that help people access mental health care? One of the ways that we do that is a great partnership that we've established a little over a year ago with Seasons Counseling, where we're able to provide free counseling services for anybody within the LGBTQ community or the greater community that might be seeking counseling services. This has been a wonderful partnership that we've developed over the last year and a half with Seasons, and it's been really wonderful for the community at large. One of the great things about that is the number of people who've contacted Seasons Counseling, not for the free services, but knowing that they are an LGBTQ accepting and affirming counseling center, that they decided to make use of those services and pay for them as opposed to taking up a spot for a free client to use for free. So that's one of the ways that we do that. Another is that we know that within the LGBTQ community, one of the most important things for mental health care is connections. So often we find that LGBTQ people, especially in rural areas, they feel very isolated. They don't have a lot of connectivity to a larger community or a friends supportive network. So that's what we strive to do. And we do that, one, with adult groups that are, identity-based, affinity-based, and those are for 18 and over. And we have a men's group, a women's group, and a trans group. They are specifically built around identities, but we feel that that's really important for people to build that network of support there. We also do this with our youth group from ages 12 to 18 weekly from 5 to 7 on Friday evenings. We have drop-in hours, and that's just a time for youth to come in and get to know each other, to find that peer support, peer-to-peer support. And the way that they do that is we have activities for them, but they can also just be there, play games on their own, watch movies, read books, whatever it is that helps them. And we meet them wherever they are. We don't try to force them into anything specific, but we do try to have some kind of activity, whether it's an art class, a crafting day. We have somebody coming into creative writing classes with them. Dungeons and Dragons is very popular. It's also a great way for those who are gender diverse to reaffirm their gender identity through playing a character that meets and identifies the way that they do. So those are some of the things that we do specifically to help address those mental health issues. We also know that there are other barriers out there, like not being able to purchase clothing that matches your identity. So we do have a clothing closet. We call it the Rainbow Locker, and it is geared toward those who are transgender that are going through their transition. So we have binders and bras and packers and breast forms and wigs and women's shoes of larger sizes, as well as clothing options and menstrual products and other hygiene products for people who may be in need of those. So we want to make sure that we take away at least some kind of barriers that they may be facing in their day-to-day life that can help them on their mental health journey. So some of the other services that we provide, we do educational outreach activities throughout the month. We have social groups that meet, much like our outdoors club. All of this you can find on our website. And when you go to our resources tab, whether it's for the adult groups or the youth groups, that's how you can sign up to get more information and get plugged into when these things are happening. You can also check out our events page and see what kind of social events, educational events, or support events that might be going on at any given time here at the center. And who is this for? This is for everybody. You know, our tagline is the LGBTQ Center, all are welcome, and we mean that. You know, straight, cisgender individuals are welcome to come to the center. They're welcome to come to any of the events that we do, but just understanding that this is a space built for and by LGBTQ individuals, and this is a safe space for them. So I hope this was informative, and I hope that you got a lot out of this, and that I hope that you check out our website and get to know more about who we are and what we offer here in the St. Joseph County area, as well as the greater Michiana area. So thank you very much and have a good day.
In over 30 counties, one of the ways that Bowen Center is working to increase access to mental health services is through our skills coaching program. Our skills coaching is a one-on-one opportunity for clinicians to teach patients how to make meaningful improvements in daily functioning using evidence-based practices. After completing an initial assessment, we provide guidance and assistance for youth and adults ages 3 and older to manage mental health symptoms in all environments so they can achieve success and independence. In St. Joseph County, we do not have a physical location where someone can come and receive in-person therapy or med management. Our community-based work removes barriers to transportation by meeting patients where they need us and provides an introduction to an array of services via a virtual platform. In order to be eligible for the skills coaching services, a patient must have Medicaid. To access services in St. Joseph County, please call 1-800-342-5653, extension 3348, or visit us at www.bowencenter.org.
Hello, my name is Felicia Howell. I am the owner and founder of Humbly Changing. We are a privately owned, minority, woman-owned business, and we have been in our South Bend area since 2018. We serve individual families as well as our community. We provide virtual therapy to those that are in need with behavior and mental health. We also work collaboratively and collectively with different organizations as well as professionals to help with the need that we are facing today as far as dealing with our mental health crisis. We provide comprehensive resources that will assist and improve the health and well-being while lowering the impact and stigma of the trauma that people are facing today. Our mission is to destigmatize mental health while striving to advocate and improve the impact of the emotional health and well-being of all people, specifically targeting our BIOPC people as well as our underserved community. We want to provide a clear pathway and stability while healing the whole wellness of those that are in need. Our vision for Humbly Changing is to have a world free from the stigma that we face of mental health while improving those and the lives and well-being of those that are in need. To provide a cultural, competent, and holistic wellness, we focus to service and promote, build trust, and to lessen the effect of the behavior and mental health that we have seen. We are in the process of doing educational seminars, we do workshops, we do motivational teaching, and these are all to help with the mind and to work with those that are in need to deal with the stress and combat the fatigue of what they may be dealing with. Our upcoming events are boundaries, learning how to deal with boundaries, learning how to have wellness of the mind, and to combat compassion and burnout fatigue. If you would like to schedule any additional appointments with us, you can contact us at 574-298-0462 or info@humblychanging.com, and one of our professional licensed trained staff will get in contact with you as soon as possible to help with the need that you are facing. You can also reach us on our website at humbly-changing.com, or you can look us up on any social media such as Facebook, YouTube, Instagram. I usually do a post every week concerning some of the things that people are facing as far as our mental health. Again, our contact information for Humbly Changing is 574-298-0462, info@humblychanging.com. And remember, there is no perfection, only purpose for all. Thank you.
How old were you when you smoked your first cigarette? Or when you became a regular smoker? Did you know that 90% of all smokers become addicted to nicotine by the time they turn 18, before human brains are fully developed? It's also true that 2/3 of smokers wish they could quit. Many have tried without success an average of 7 times. Does this sound like you? Do you have the courage to quit? Developed by the Respiratory Health Association of Illinois, Courage to Quit has helped thousands of people break free from the chains of nicotine addiction. Just listen to one successful quitter and program graduate, Brandy.
I am a certified addictions peer recovery coach and lead trainer for recovery coaching in the state of Indiana. My addiction to nicotine stood in the way of me being an addiction-free supporter for those in recovery. For 6 weeks, we worked to identify smoking triggers and ways to combat cravings and withdrawals, as well as stress management techniques, and it worked. The program helped me become addiction-free, and now I'm officially non-smoker. My breathing has improved, and I smell a lot better. Saving time and money on cigarettes has allowed me to invest in my professional development. I encourage tobacco users to enroll in the free program. It worked for me, and it can work for you.
Click the link to find out more and to register for the next schedule of classes, or call 574-335-4699. You can quit, but you don't have to do it alone.
Hello everyone, welcome. We are Healing with Human Connection, and we're going to talk about our programs today with the Mental Health Summit. So Without further ado, I'm Jeanne Cannon. I'm a clinical social worker and have a private practice here in Michigan City. Go ahead, Stacey.
I'm Stacey Garcelon. I'm the director of Anam Counseling in LaPorte.
And I'm Lisa Scheller, an author of a new book called From Fear to Faith, A Family's Journey with Addiction, Recovery, and Grace, as well as I do a little bit of health coaching and family coaching for addiction.
Thank you. Thank you, Stacey. Thank you, Lisa. And thank you, Megan, our tech gal. And honestly, we have been doing this podcast for a while, and the reason for the podcast is to connect those listeners in our world with resources in our community. So weekly, and we're getting our wheels rolling here, but weekly we try to host someone in the community who is in the world of substance abuse and recovery and mental health issues of any sort, and that we can spotlight them and highlight them and talk about what's available. So let's see.
And I just want to say that,
Sure.
When we decided to do this podcast, we understood that addiction and mental health go hand in hand. So if you have mental health, you might have addiction, and if you have addiction, you might have mental health problems. So, and we're seeing a lot of that now that the COVID has opened up, and seeing more that people are struggling, and that there's a lot of resources out there, and we just want to be there to share, to be a part of the recovery program.
Yeah, and to help end the stigma of mental health. There's this big stigma out there that, I don't need to go because there's nothing wrong with me. Or if I go, so people will know something's wrong with me. And we all have physical health. We see a doctor,
Yes.
like we all have a brain. So
Yeah.
we all have mental health, and we need to have those resources and to care for ourselves.
Yeah.
So this is to help end that stigma.
That's great, Stacey. So maybe what we can do is we'll take each one of us, talk about what we do specifically and what our programs are. Stacey, do you want to go
Oh,
first?
yeah, sure. So I'm the director of Anam Counseling. We provide traditional mental health counseling, such as cognitive behavioral therapy, dialectical behavioral therapy, and that sort of thing. We also do EMDR, which is eye movement desensitization reprocessing. But one of the unique things about what we offer at Anam is we offer equine assisted psychotherapy, specifically trauma focused as well. So we partner with horses on the therapy team, and what the horses bring to the therapeutic process is absolutely amazing. And I can talk about that for hours, but I will pause there and just welcome everyone to come and check out what we have. We have we do individual and group therapy. We also offer opportunities to come out and meet the herd. So we have a women's group, a veterans group, a new men's group that's coming, and we have a herd meditation so people can come and meditate with the horses. And those are all donation based. And we have a grief group as well. So with COVID, there's been a lot of grief in our community.
Yes. Yeah.
So those are all some opportunities to come and check us out.
So if anyone wants to check you out, Stacey, they should go online to Anamcara.
AnamCaraStables.org, and that is spelled AnamCaraStables.org. And then the phone number is 219-207-7222.
Great. Thank you, Stacey.
Thank you.
And Miss Lisa.
Yeah, so again, to mention that we have a new book out called From Fear to Faith. And so I've been doing a lot of different work in the community with the book, trying to get the resources out so that people know they don't ever have to travel this alone. As a family member who has dealt with my husband, who's a recovery alcoholic, and been doing a little bit of work with Anakara and helping do some raising of funds so that her programs can continue to happen in the community to make sure that people know they have a place to go. But just very passionate about my recovery as a family member, and I want to be that person that can walk alongside the families to know that you might be dealing with this, but you're going to be okay. And we always know that it takes human connection to have that relationship, and that people don't feel like they have to figure it out, because we don't always have we're not thinking straight, and we don't always have the tools that we think we should have.
Oh gosh, Lisa, that is so great. And the book, again, From Fear to Faith, is fabulous. Having family member gone through addictions and recovery, the book is fabulous. So if nothing else, if you're listening, definitely pick up that book, or you can certainly call Lisa too.
Yeah, and I have a website. It's called Heart and Health, and also a Facebook page. So it can be reached.
Thank you. And lastly, I'm Jeanne Cannon. I'm a clinical social worker, been in my private practice over 20 years, mostly women's issues, couples counseling, but deal in all type of mental health issues, depression, anxiety. So if you're interested, you can certainly give me a call. I'm located here in Michigan City on 7th Street, but I also do online therapy and life coaching. So the number is 219-878-0322. And I think it's safe to say that for all of us, that just give us a call. If we're a good fit, great. If we're not a good fit, I do a lot of referring out.
Yeah.
And we've all been in the field a long time. So if we can't help you, we certainly have some ideas of what can help you. And answering any of the fearful questions that you may have about reaching out, we're happy to do that, honestly, for free on the phone. No strings attached, no judgment. And as both Stacey and Lisa have talked about, you know, any one of you out there is eligible to just give us a call and get information, because as Lisa talked about, connecting to people is the answer, because education is powerful, and learning some of the pros and cons, and this is what is helpful and this is what is not helpful, whether you're the person struggling with mental health or substance abuse, or you're a family member of someone with struggling with substance abuse or mental health. Finding out the whys and wherefores is a beginning. So we wish you all good health. We thank you for joining us. Anything else you want to add?
Just that our podcast can be found on YouTube. It can be found on Facebook. We have a Facebook page, Healing with Community Connections, and a couple of different platforms. So again, like Jeanne had mentioned, we are out here to spread the word in the community, in the Northwest Indiana, anywhere. Just, you know, we have different guests from all over, and just a wealth of information. So yeah.
Great. And again, as Stacey said, you know, there's no judgment to getting help. Just as if you had a physical problem, you go to a doctor. Mental health, substance abuse, wow, let's get the help you need. And the beginning is finding out what kind of help is out there.
And you're not alone.
Oh, golly, thank you. So thank you for listening. Thank you for joining us. We wish you all the best. Be very kind to yourself, and we wish you courage to reach out and find out more information. Thank you.
Since 1994, Center for Hospice Care has provided Camp Evergreen to support school-aged youth ages 6 to 18 who have experienced the death of someone in their life. Under the direction of licensed counselors, Camp Evergreen provides fun and meaningful ways for campers to address their grief with others who have experienced similar loss. For more details on Camp Evergreen, call 574-255-1064 or email evergreen@cfhcare.org.
Hi, my name is Taylor Nicoletti. I'm an assistant clinical professor in the Department of Psychology at the University of Notre Dame. I'm excited to share with you 3 ways that the university is increasing community access to mental health care. The first way the university is increasing access to mental health care is through our Child and Family Therapy Clinic, where we offer evidence-based clinical services, individual therapy, and family therapy to children, adolescents, and families in the Michiana region. If you know someone that's interested in receiving our services, you can give us a call at 574-631-0954, or you can visit our website at shaw.nd.edu. To tell you a little bit more about our clinic, it's a nonprofit mental health service, training, and research center that's operated by the Department of Psychology at the University of Notre Dame. Our services are provided by our Notre Dame doctoral students who are therapists and are being supervised by Notre Dame faculty like myself. We serve the community, so we serve Notre Dame, we serve South Bend, we serve the surrounding areas, all of Michiana. We provide individualized, scientifically supported therapy services for children and families. Some example concerns we treat are like anxiety, depression, post-traumatic stress, behavioral problems, inattention, and organizational concerns. One thing to note is that, like many of our mental health resources right now, our wait list is pretty lengthy, and our next likely ability to take in more clients will be spring of 2023. But again, we want to keep you all aware of these exciting services. So to let you know a little bit more about the clinic, we offer a flat rate of $10 for each therapy session, and fee reductions are available based on the financial need of the families we work with. We're not connected to any insurance companies. Our services are housed at the William J. Shaw Center for Children and Families. That's at 1602 North Ironwood Drive. And again, if a family wants to reach out to us about services, they can give us a call at our intake number, which is 574-631-0954. Another exciting program that is happening at the Shaw Center is our Pregnant Mothers Empowerment Program, or PMEP. This is a 5-session group support program that is available for pregnant mothers who have experienced conflict with their partners. If you know someone interested in these services, they can give us a call at 574-383-9402, or they can sign up at shaw.nd.edu/participate. Our final opportunity is the Spirit Initiative. So this is a new initiative happening at the University of Notre Dame that is focused on suicide prevention and treatment. We are really focused on treating and preventing suicidality among children, adolescents, and adults. Our goal is to make this both a direct clinical service for the community as well as increasing research opportunities. So our therapy services will likely be available at the beginning of 2023. Our research opportunities are happening right now. We have a research project going that is specifically looking at adolescents and their non-suicidal self-injurious behaviors. If you know of an adolescent between the ages of 12 to 18 that would be interested in participating in this research project, please call 574-631-0950. Thank you.